My name's John Brookes. I'm a consultant ophthalmologist at Moorfields Eye Hospital in London. I also work at Great Ormond Street Hospital for Children. My area of interest and expertise is dealing with glaucoma from childhood to elderly patients, and also dealing with cataracts in mainly elderly patients as well. I've been in ophthalmology since 1995, so nearly 20 years now. My main interest is in all types of glaucoma. I have a particular expertise in treating children with glaucoma, so really from newborn, but right through the age ranges to elderly patients with glaucoma as well. I also take a big interest in treating patients with cataracts, again from childhood to elderly patients. Working at the two major teaching hospitals in London, Moorfields and Great Ormond Street, we have a really active programme of research and training the doctors of the future. My own areas of research at Moorfields would be in the medical treatment of children with glaucoma, so evaluating the effectiveness of drops and the effectiveness of eye drops for managing the pressure, but also the surgical management. And the surgical management of glaucoma is quite challenging, and we need to try and find better ways of treating that, so we're always looking at new methods of surgery. In terms of education, about half the doctors who become ophthalmologists in the UK at some time pass through Moorfields Eye Hospital. So there's a huge programme of teaching, and we're very active in training tomorrow's doctors. So the junior doctors come through the glaucoma service every 4 months, so we're continually training the new doctors that come through. I think with problems with eyesight, there's always the dilemma of whether this is a very minor problem or a more severe problem. And I think as a general rule, it's probably better to see somebody sooner rather than later, because there are conditions that can lead to irreversible sight problems. And often the sooner that these conditions are diagnosed and treated, the better the long-term outcome for the patient. So it does no harm for a patient to go at an early stage if they're worried about their vision. If it's a minor problem, they can be reassured, well, they've lost nothing. But if it's something that needs more major treatment, then they've caught it at the earliest opportunity. I think it's important for patients to bear in mind that most eye problems are self-limiting and minor, and the recovery will take place very quickly. And that's the majority of eye problems. But there are eye conditions that do need urgent treatment. They're in the minority, but it's worthwhile having them checked out. So if it does need treatment, it's caught at the very earliest opportunity. And the outcome of the treatment is more successful the earlier these conditions are treated. So to come to the clinic to see me, often patients who have medical insurance need to get a referral via their general practitioner. I'm very happy to see patients without a referral, but often medical insurance companies insist on that before they will reimburse the fee. But if somebody wants to ring me up directly or my secretary, I'm very happy to see people without a referral letter.